Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist, professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in harder hit communities across the state of Georgia, and am the host for Emory's COVID-19 videos where we cover important topics about the pandemic. Today, I'm very pleased to be joined by Dr. Marybeth Sexton as we talk about the best kind of mask to wear as we see Omicron continuing to spread across the United States. Dr. Sexton is an assistant professor in the Department of Medicine in the Division of Infectious Diseases at Emory University School of Medicine. She is the director of the antimicrobial stewardship at Emory University Hospital and the epidemiologist for the Emory's physician group practice. Welcome and thank you so much for joining me today, Dr. Sexton.
Thanks for having me.
Absolutely. Quickly, here's a very fast look at our COVID-19 numbers across the United States. Cases are up more than 98% in the past 2 weeks, with a daily average of more than 800,000 people testing positive a day in the United States. 28 states currently have case rates that are more than 300% higher than last January. 99.6% of the country is in the highest category of community transmission, which means that for almost 100% of this country, mask wearing is recommended when you are indoors in public spaces. There are more people now hospitalized with COVID-19 than at any other point in time in this pandemic. And very unfortunately, almost 2,000 people a day are dying from COVID-19 in the United States. This is almost at the peak that we saw during the Delta peak in the fall. On January 14th, the CDC updated its mask guidance to note that KN95s and N95 masks offer higher levels of protection for COVID-19 than cloth masks. So today we're going to walk through that new guidance and talk through our different forms of masks that we have available and help you recognize if yours is fitting you well or not. So Dr. Sexton, let's start with the three kinds of respiratory masks that we have. The N95 is really considered kind of the premier mask that we have because they are NIOSH approved respirators and they offer the highest level of protection. What does that 95 stand for on the masks?
So the 95 stands for the 95% of particles that this is going to filter out. So this is an example of one. Because of the way that they seal to your face and because of what they're made out of, they really do filter out the majority of respiratory particles, viruses, whatever is in the air around you so that you don't breathe that in.
Very good. And so how should these fit? We both are holding one, I think probably actually the same one. These do go around the back of your head. So how do we want to see an N95 mask fit?
Yeah, so if you're going to wear one, the thing to remember is that 95% only holds if it's on correctly and if it fits you well. And so you want to make sure not only that you know how to put one on correctly, but that also you're comfortable enough in one to wear one correctly if you're going to use one of these. So what I do when I put one of these on is that if you've got the kind that go behind your head and that aren't ear looped, I hold it in front of my face. I start with the bottom one that goes around and below your ears. And then this one will come in the back of your head, kind of above the ears. One of the things I always have trouble with is this slips. So I try to get this kind of as high as possible. And then you adjust the nose bridge so that it really molds to your face. And then you do a seal check, basically, as you put your hands over the mask, you take a breath in, and you should feel the mask collapse a little bit as you breathe in, and then take a breath out. You should feel it push against your hands, but you should not feel air up by your eyes or around the sides. That's how you know that it's on correctly.
Awesome. I've also heard that, some people test them. There are ways to test them in the hospital, but an at-home test that works pretty well for this particular kind of mask is if you have it completely on, you can take a utensil, like a knife that you've put in the freezer, a butter knife, and if it changes the condensation when you're breathing in or out on either side, it shows you that you do not have a well-fitting mask on at that point. Let's move to the KN95s. These are a version that comes from China that is a similar sort of filtration to the N95s, but these are not NIOSH approved. And they typically have ear loops as opposed to going around your head. Again, I think we might have the exact same one that we're both holding. And mine has the metal bridge on the external part of the mask rather than the inside. So let's talk about these masks for a second.
So these theoretically filter the same way. That the 95 is again for 95% of particles filtered out by the mask. The difference is that the N95s that are approved by NIOSH go through testing in the United States, so we know that they do that. There's not as much regulation of the Chinese manufacturing of these masks, so you often don't have proof that they do that. But there are some that are made both in China and by US companies, and some that have been validated by US companies. So there are some that probably really are equivalent to an N95. At any rate, they do tend to be pretty sturdy, well-fitting, thick masks. And you similarly want to do the same kind of thing here, where this has ear loops, but you're going to get it around your ears. And this one fits me well. It's the reason I like it. But you can do things like twist your ear loops or knot your ear loops if you've got trouble getting this to hold. And then these have a nose bridge too that you want to pinch around. And again, you're looking, you don't want to feel air up by your eyes. You don't want to feel air over here. You don't want to feel air escaping below your chin. And you similarly, like you can see when I breathe in, you can see that go in. That means I've got a good seal on this.
Yeah, I think one of the things with these masks is that the way they fit across my cheeks, they don't they don't feel like they fit as tightly, even when I get a good seal on it. And so for me, these are a little bit more comfortable than an N95, especially for longer periods of use.
Ditto. I can wear one of these for a couple hours comfortably and potentially even forget I have it on. My limit's about 30 minutes.
Yeah. We're going to move to my personal favorite, which is the KF94. This is the Korean version of the respirator. It's moved down to 94% filtration. It's a little bit different in the way it is formatted. It's considered a 3D mask where it's got multiple parts. So you pull out your top and you pull out the bottom. The bridge is inside on this one. Again, it's ear loops. And then you have to push it down and it goes completely underneath the chin. For me, this one happens to work particularly well. I have a pretty round face and a lot of cheeks. And so this fits very nicely and goes further up my face. And again, you can see the seal that I get on this one. This is what I use to teach in. One of the other things I like about it is it does not touch, just like the the KN95, sorry. This does not touch my lips or the bottom of my nose. And so it doesn't change my diction. And I can teach an entire class for hours in this and also forget that I have it on. So that's my personal favorite. And then it collapses back together when you take it off. All right, let's move to surgical masks. So these are the blue or yellow 3-ply masks that this is what we used to always see everyone in hospitals wearing. Let's talk about how well these work.
So these honestly really depend on fit, how well they work. So the problem that some people have, and I am one of them because I have a small face, is if I put this on, you can see I've got huge gaps here, here, and here. Even if I can adjust the nose bridge and adjust the mask somewhat, but this is really gapped here. And so this is probably somewhere in the 60 or 70% effective. It's a little hard to know. I am one of the people who uses something over it. So you see, if I put a cloth mask over this, I now have this completely flat. And there are studies that were done during the Delta wave that showed that this kind of combo, or something where you modified the mask in some way to make it fit better, was up near 90 to 91% effective. So you can get this to be almost as effective as some of these other masks, but it's got to fit you right.
And you have to work on it. So I put one on and I have a much bigger face, I think, than you do. And I still have gaps here. It also comes down lower. And so I can feel some escape of air when I breathe in and out from this. And it's pretty loose underneath my chin as well. So I also do better to either double mask with this or put a cloth mask over the top, one that fits me particularly well. I'm particularly interested in trying to put the sides down and keep the chin a little bit more in when I wear these. These are a little easier to find though. And so certainly when we move on to our cloth masks, I think that these are preferable if you have access to them to a cloth mask. So let's
agreed. This is much better. Even this alone is, offers substantial protection. And if you can, there are videos on even the CDC's website of ways to either knot these, sort of cross these to pull the sides down. Some people will use a plastic ear saver where you get this on and then you connect to something that's in back here, and then you really do get this pulled flat. So there's a lot of things you can do with this to make it fit better. And so if your choice is between this and cloth, you absolutely want this.
Yeah. And my problem with wearing these is I tend to fiddle with them more because they don't fit me quite as well. And as a result, I'm not as comfortable in it. And I am less inclined, to want to put it on. And that's a problem. You want to wear the mask that fits your face the best.
No, like I feel I have, when taking care of non-COVID patients throughout COVID, I have worn this combo rounding in the hospital. I feel very good about my level of protection with that on. I, in fact, worked for 3 hours in basically a 2x5 room with someone 30 minutes before they came down with their 102-degree fever with COVID and did not get COVID while I had this on. But this is hot and it's right across your face like this. And so it can be irritating. It can be hard to hear when you talk. And so again, I think I completely agree with the point that you want something that is comfortable for you and that you're going to wear and that's high quality.
Yeah, that is a good point. My diction has changed when I wear these a little bit. I'm a slightly more muffled sounding, but again, preferable to not wearing a mask 100%. Okay, let's move to our good old cloth masks. Remembering back at the beginning of the pandemic when everyone was making their own, or all your favorite clothing stores were starting to be able to make these and ship these out. How well do these work? This actually fits me pretty similar to the surgical mask. In fact, this one fits me slightly better than the surgical mask I just had on. So this is a great one to go over it for me. But let's talk about why these are not our preferred form of a mask during COVID-19 with Omicron.
And part of it is just how variable they are. Because they're like this one actually that I have, I think is a very good quality one. It's got multiple layers. It's actually made with a vacuum filter in it. And then it's got a nose piece to prevent your glasses or safety goggles or whatever from fogging. And it's actually got adjustable ear loops. So this fits very well. On the scale of quality of cloth mask, this is probably near the top, but something that you made yourself, something that has one layer, something that you can't adjust the ear loops on and that has gaps is going to be tremendously worse. And there's just such variation that I think that's part of the problem. I think the other thing with Omicron is that we know that it's more contagious. We're still learning about all the reasons why, but the degree to which it's contagious really suggests that it's not going to be as forgiving of errors, basically with your mask. So if before your mask had gaps on the sides, or it was a single layer or a double layer cloth mask, or it was falling below your nose occasionally and you were pulling it back up, that was probably not going to be enough to cause a problem. Now that may be enough to cause a problem. So you really want something that's uniformly very high quality and that's going to stay put.
Certainly this is better than not wearing a mask, but I'm going to show you an at-home way to test. And again, this is one that fits me really well. And you can see, it is, when I inhale, it is coming in, but here, back to our candle. We did this about a year ago, I think. I can't blow out the candle with this, but I can move the flame with this one. So that's more than you'd want to do. This is better, obviously, than nothing. And again, I can't blow out the candle with it, but if I were to switch to this KN95, I don't even touch the flame with that one. And, so that's showing you a little bit of a difference in what you're getting in as far as what's escaping from your mask. And so that is one of the tricks that you can use. And you can also, don't hold it too close to your hair, but you can put it off to the side and you can look and see how air is escaping on the top. And then if you wear glasses, just knowing if your glasses fog up, that's alerting you that your nose bridge is not tight enough or helping escape there as well. Counterfeit masks have become a thing to talk about, and it's kind of an interesting concept that these really good masks that you could get one that looks like it and it may not be quite as good. So what does it actually mean to be a counterfeit mask? And then we're going to talk about why that might matter.
So because these for a while were harder to get as the pandemic started and there were supply chain issues, there were a lot that flooded the market that aren't made to the same standards. So real N95 masks are evaluated, as you mentioned earlier, by NIOSH. And so we know that they meet those regulatory standards. And so there are some N95s out there that aren't on that list. And the same thing with KN95s, even though the regulatory process is not as stringent in China, there are some that are on a NIOSH list where they have looked at them, they've looked at the manufacturer, they believe they're made to those standards. And so if you have a KN95 or an N95 that's not on the NIOSH lists, then you do worry that that might be a counterfeit mask that's been made to some unknown standard. It's just not held to that same 95% filtration, or 94% in the case of the KF94.
Right, so that's really what that's talking about. I mean, it's not a mask. It's just a mask that hasn't been tested or is not assured to be as filtering of a mask at the level that it may be claiming to be.
Right. And so when you look at them, they are often still thick, well-fitting masks. So but the problem would be if you were, for example, a healthcare worker and you were going to wear a KN95 instead of an N95 in a COVID patient room. And one of the reasons that's not recommended to do that is that the KN95s aren't necessarily validated the same way, and there's a lot of counterfeit ones out there. So if you were going to use it for something where that filtration really, really mattered, then you would worry more about it.
That's good to know. And we can also lead people towards the CDC website, which has a great listing of both counterfeit masks and how you tell if one is. It gives you some information about where you should expect to see NIOSH listed on your mask, that needs to be spelled correctly, and a few things like that, as well as some links to places to get certified masks that they have tested and feel are appropriate. So as we think about Omicron and really the fact that it is spread all across the United States right now with rates that are just frankly unbelievable, who should be wearing a mask?
So this really is the absolutely everyone answer. So really anyone over the age of 2 who is out in public, particularly in indoor public areas, should have a mask on. Because one of the both blessings and a little bit of the curse of Omicron is, especially if you get infected with it after vaccination or after you've had COVID before, it can be incredibly deceptively mild in terms of symptoms. So, and this has been the case with COVID all along, but even more so here, is that people can have things that they think are allergies or that they don't really notice. Things like fatigue or headache or a little bit of sore muscles or a scratchy throat or some congestion can be this. And so even if you're not particularly sick, that doesn't mean you're not going to encounter somebody really vulnerable while you're out. So if you have the mask on, it makes sure that you don't spread something very mild that you haven't noticed to other people. And then the good news about these really high quality, well-fitting masks is, early on, we talked about my mask protects you, your mask protects me. These are both. My mask protects you and me. These are tremendously effective at protecting you from other people too. So this, because somebody else could be out there with mild symptoms or no symptoms. And so this wearing a mask really provides excellent protection at you not infecting somebody else and you not getting infected.
I think that's so important because that is a real change from what we were talking about, particularly with the cloth masks. Another change from the cloth masks is we washed these and all of these other forms of filtered masks, we are not washing. So how often should we be changing these and how long can we wear the same mask?
So it's a little bit variable depending on what the mask is, how long you had it on for. You definitely do not want to wipe these with anything or wash them. It will completely ruin how effective they are. But what you can do is if you've got one that otherwise is okay, and we'll talk about what that means in a minute, and you want to rotate them, if you put one of these in a paper bag and leave it for a couple days, if you've got bacteria even or viruses or anything that you've got on the surface of that is going to be dead. But the question really is it holding its shape? So if I pulled this out all of a sudden and it looks like this, we're not going to reuse that. It's time for a new mask. If it's visibly not holding its form, if you've got anything on it, and this is more true in healthcare settings, in the community, you shouldn't end up with blood on the outside of this. But if you have dirt or anything visible on the outside of this, it's time for a new one. If you're wearing one of these and it starts to feel wet, it's time for a new one. And then with the KN95s and the N95s, you will eventually basically clog the filter in the mask. And the signal that you've done that is that it starts getting much harder to breathe through. It'll start to feel like you're sucking on a straw, and then it is time to change out your mask. So if it's visibly dirty, if it won't hold its shape, if you put it on and you can't get it to fit, like if you can't on that seal check, if it doesn't blow out and retract in, if you're getting air that escapes, it's done, you need a new one. And if it's hard to breathe through, you need a new one.
I've also had issues where I've worn one long enough that the ear straps start to get too loose, and that's when you start to lose your shape as well.
Yeah, and some of them are worse about that than others in terms of how long they will last. But certainly if these are suddenly too stretchy and they won't hold, you need a new one.
Very good. All right, last thing. Outdoors, the CDC does not recommend that you need to be wearing a mask outdoors in all spaces, but certainly there are times you should consider wearing a mask when you're outdoors. So what is kind of your threshold for wanting to put a mask on if you're in public spaces outdoors?
Mine is if I'm not going to be able to distance from other people and I'm going to be there a long time. So if I'm going to be sitting right next to somebody and having literal face-to-face contact with them, being outside is certainly much safer than being inside, but it's not foolproof. So I will wear a mask in that setting. I think that if you're going to be spaced out, like if you were playing soccer outside, you don't need a mask on. If you're sitting 6 people on one side of a picnic bench all next to each other, you probably do want a mask on. And it also depends on where you are, because there's outside in the complete open, and then there are partially enclosed sporting arenas. So there are varying degrees of air movement, even when you're technically outside. So if I were sitting in a crowded stadium right now, I would wear a mask.
Very good. All right, the last thing I want to touch on is wearing the mask that fits you best so that you will wear one. We all have preferences. We all have styles that fit our faces best, and we all have different access to masks. So I really want to end with stressing, whatever mask it is that fits you best, knowing that we're all in a space right now where wearing one is really important for both you personally, as well as those who are around you and the people you're going to go home to. It's really important that you have one with you at all times and that we wear them.
And I'll just wholeheartedly second that. I think there's a lot in the media right now about N95s and KN95s, and they are really good quality masks. But that 95% filtration, you only have that if you have that on correctly and really well fitting and with a good seal. And sometimes that is really uncomfortable, especially in an N95. I think I said earlier, I can't wear this for more than 30 minutes without feeling like my face is going numb or I'm going to pass out. And so if you have that experience and you're going to be, moving this up and down your face, pulling it out to take a breath, putting it back on, taking it off some of the time, then that extra, 5 or 10% filtration that you theoretically get with that is useless because you don't have it on, right. You're not actually getting that protection. You're actually made it worse because you're moving the mask around and taking it off. So you want the best quality mask that fits you well and that you are actually going to be able to wear comfortably for a long period of time. And so whether that's one of these that you modify to make it fit better, whether that's by messing with the ear loops or putting a cloth mask over it, whether that's a KF94, a KN95, an N95, whatever that is for you. And I've suggested to people that they experiment and find what works. I had been wearing the procedure mask, cloth mask the whole time. I tried one of these KN95s. I actually really like the way it fits my face. And I'm much less hot, and I think I'm easier to understand, for example, when I'm talking to patients. I don't feel like I'm screaming the way that I do sometimes with this plastered with a cloth mask over it. So try what works for you.
And we will end with, it is important to not only have one on and have one on that is comfortable for you, but to remember it does need to go over your nose. Your nose is part of your respiratory tract, and so it needs to go over your nose, fit well there, and then go down underneath your chin and fit on the sides. So we hope this is helpful, and we hope that everyone will remember that wearing your mask both protects you and protects those around you. This is super important as Omicron spreads across the United States. This is not forever, but right now with a super transmissible variant, this is one of your best defenses to add on top of being vaccinated and being boosted. So Dr. Sexton, thank you so much for joining me today, and thank you everyone for watching.
Thanks a lot.